Healthy by George. This is MC, and we're here today again to talk about metabolic syndrome. And to me, this is one of the most confusing things that I deal with because it's something that I'm not quite sure what it involves. A lot of people talk about it as insulin resistance. And today we have my brother, the nurse practitioner who's been in medicine for years, working with patients of all kinds. And so I'm so happy to have him on to help us understand better metabolic syndrome. Don't forget, subscribe, click that like button and the bell. We're here every Sunday and Thursday. Welcome to Healthy by George. I want you to know that this is for informational purposes only, and it should not be considered as medical advice, nor does it have anything related to my employer. So it's always best for you to check with your own medical provider before you do anything that I recommend or for any medical treatments. So please join me, hit that subscribe button, and turn on notifications so you never miss an episode. So welcome back, my brother.
Thank you for having me.
I'm so glad to have you here to talk about metabolic syndrome because frankly, to me, it's so confusing. I feel very confused by it because I don't think there's a test, is there, to say, oh, yes.
Well, it used to be called insulin resistance syndrome.
Right.
But that was so vague that they made it a metabolic syndrome. And then what happened was they got the metabolic syndrome confused with a syndrome of hypertension, hyperlipidemia, and obesity. Mm-hmm. And people often confuse that's the metabolic syndrome. But it's actually 5 things. And if you're positive for 3 of the 5 things, then you have a metabolic.
Okay, so because the first time I said this to my orthopedic surgeon, I said to him, I think I have a metabolic syndrome. He looked at me like I was crazy, and he says, what do you mean? Okay, because I think sometimes our healthcare practitioners don't know what it is either.
Well, things have changed very much. I mean, in the last 5 years, actually last 3 years, diet and different risk factors, the more we know about food. And actually, I think medical doctors only get 1 or 2 classes with nutrition in it.
Really?
Their whole medical education.
Wow. Yeah.
So they get very little nutritional education.
Right.
They understand how the body works and they understand how the metabolic system works, or what it is to calculate the metabolic rate. But they don't get a lot of nutrition education in medical school. At least they didn't. I don't know if they've changed it. I think they have changed it a little.
Really? And is nutrition kind of the key issue? Or what are these 5 elements?
Everything has changed. Food has changed. The way things are prepared has changed. Preservatives, the way that they actually, what happened was 2 years ago, they didn't know how to store large amounts of sugars and fructose. And so they started concentrating. And actually, it's cheaper if you concentrate it. You can actually store it in a smaller space, and it's actually cheaper to sell.
Huh.
And that's one of the things people don't realize, that most of the sugars and corn syrups and other fructoses, sucroses, and dextroses are concentrated. And so what they're selling or what we're eating or consuming is a very high or concentrated sugar or fructose. And our bodies just can't handle a huge bolus of that kind of sugar. But if you do have
what are the 5?
3 of these 5 things.
But what are the 5 things?
A large waist circumference. It's
how big is that?
40. It's greater than 40 inches
greater
in
than
men.
40.
Greater than 35 inches in women.
Oh, really?
Yes.
So greater than
high
30.
Blood pressures.
So wait. So 40 in men around the waist, 35 in women.
And it's around the waist where your belly button is.
Okay. So if you have a large waist, then blood pressure.
And then blood pressure. So if you have a low HDL cholesterol.
Low?
Yeah, lower than 50 for women and lower than 50 for men. 40 for men.
50. So why low?
Because HDL is a protective cholesterol.
Oh, I see.
And if that's higher, then you have a higher chance of being protected against the bad stuff.
I see.
Like triglycerides and sugars.
Okay, so if it's low, it's bad.
Uh-huh.
Okay.
If you have a fasting glucose greater than 100, that's considered a problem.
So
And
that
if you have
means,
triglycerides, if you
okay.
have high triglycerides or triglycerides that are above 200, that's a problem.
So wait, let's talk about fasting glucose. Is that the kind where you prick your finger and then or is it actually a blood draw?
It can be a finger stick or a blood draw.
Okay, either. Because the thing about it is, if I do a finger stick, I'm about 99 or 100. If I do a blood draw, it's 80.
Okay. It's either one, right? It just says fasting blood glucose greater than 100 milligrams per deciliter at any given time.
And then if you have 3 of these,
factors,
you have a syndrome.
You have metabolic syndrome.
And then what do you do to change it?
Well, that means you do need to make some changes to those 3 factors.
Well,
you need to get your waist and your weight down.
You need to reduce your weight and exercise, right?
Yeah. So you need to get your blood pressure under control. You need to get your blood sugar under control. It depends on what's wrong, which of the 3 of the 5. Some people have all 5, Catherine.
I bet.
Some people have all 5. Can you imagine?
Yeah, I can't imagine.
And,
well, because
we used to separate it in modifiable and non-modifiable risk factors. Now they've separated it in the 5 identifiable factors that contribute to the metabolic syndrome.
Right.
And if you have them, guess what?
What?
You're usually insulin resistant.
And so how can you...
And what does that mean?
I don't know, to be honest with you.
It means that you have a lot of circulating sugar.
Right.
And also the insulin that your pancreas is making is not efficient and not working.
Right. So that means that you have a greater risk of cardiac disease.
Right. Well, see, what happens is you have big molecules of triglycerides circulating around, big molecules of blood sugar circulating around.
Right.
You have high blood pressure.
Right.
So those big molecules in combination with high blood pressure leads to end organ disease, such as
kidney damage and heart damage.
Eye damage.
Oh, really?
Yes.
Vision damage. So that's...
People they're like, why are my kidneys bad? Why do I have these vision problems? Well, guess what? Your eye circulation, your eye vessels are not made for high pressures. And when you have high pressures along with elevated triglycerides and elevated blood glucose, that means the molecules inside the vessels are also very big and very
damaging.
What's the word I see? They're dangerous. They're big molecules and they're banging on the vessels, and they can cause damage.
I'll be darned. So that means your kidneys are at risk, your eyes are at risk,
your heart,
your heart's at risk,
your lungs, your brain, your vessels,
what about your liver?
Your peripheral vessels, your fingers and your toes.
Okay. So all of those are at risk of
damage.
This
all affects everything. So if you can get these 3 modifiable or 3 risk factors down, you can hopefully get away from possibly being insulin resistant, or at least recognize you might have insulin.
The GLP-1 drugs, apparently, because they are reducing your diabetes, they're reducing
your weight down.
Also, too, they've
getting
seen
your sugar down.
That it has...
Getting your triglycerides down. So it gets 3 of the things down that you want.
All at once. And it helps with cardiac disease.
The problem too now, Kelly, is that there's a shortage of it. I have patients that can't get it.
I know. Well, thankfully, I've been able to keep getting it. But I know that other people have struggled. And also, too, some people can't get access to it because of the type of insurance that they have. And then they can't afford it because it's like $900 to $1,200 a month. You know. But there are things you can do that are not about the medicine, right?
Right.
So if you increase your exercise, maybe
control your blood pressure, control the amount of sugar
you're eating,
fats you're consuming.
Yeah, and those would be like and then
it's all lifestyle changes.
So
your doctor puts in his note, recommend heart healthy diet and lifestyle. What does that mean?
I don't know. Believe me, that seems very confusing.
Well, the thing is, he's satisfying what he needs to satisfy. for the insurance companies to say that he's educated you on something.
But what have you?
But people don't even know what a heart healthy diet and lifestyle means.
No. I mean, if I think of heart healthy diet, I think of salt reduction, not sugar.
Well, it's not only salt, it's low fat, low cholesterol.
Right.
Less animal protein.
Right. And so that means eating more vegetable protein.
More fresh fruits, more
yeah,
fresh
vegetables, exactly.
Less processed foods, there's so much sodium and sugar in all
And that's
foods.
hard because people are busy. People don't have time to cook. They end up running to get something at the fast food store.
Well, they are making things a little bit more available. I noticed in all my fast food stores, there's cut up fruits, there's cut up vegetables, there's vegetarian sandwiches now available.
Really?
There's what's called it looks like a yogurt parfait, but it's healthy yogurt, and the top of it is fresh fruit.
Is that really going to be
And some
good?
people use that as a meal.
Okay. Well, there's more protein in that, but there still is quite a bit of sugar.
And there's a ton of protein bars out there.
Yeah.
They're full of sugar.
So I guess the thing is to assess, if you want to know about whether you have a metabolic syndrome, you need to assess these 5 factors, which we'll list below in the show notes.
Yes.
And if you have 3 of them, it really is an indicator that you have a metabolic syndrome.
Metabolic.
And you can bring it up and talk to your doctor, maybe have a nutrition assigned to you.
Yeah, and most insurances will pay for at least one nutritional consult. And this is the other thing too, is most insurances will pay for one complete wellness exams.
So what does that mean?
That is a thorough head to toe physical with inventory, education, review your labs, and that's including everything. So you're supposed to go to the doctor a week before you have the healthy physical. You get all the labs that are done, which is everything for your age.
Right.
And the week after, you sit with your doctor. You do a whole history, an inventory of what your lifestyle is doing, how much you sleep, how much you eat, what you eat, how active you are, how much you work. And it actually is a detailed health history. And then the doctor is supposed to go over your labs thoroughly and also explain to you in detail what changes need to be made in your healthy lifestyle.
Let me tell you something.
Can remain healthy. And people don't realize you get one. And actually, my company that I work for, they pay their employees $350 to do it.
Really?
Everybody does it. Yeah, they pay the doctor like $600 to do it.
Wow.
They pay the employee $300.
Okay, that's amazing. I would do it in a heartbeat. That's not what.
Well, it's called a annual. You only get one. It's called an annual total health physical.
Well, I get a reduction in my health care insurance. That's what
You have to have that total physical.
Yeah, I have to have the wellness physical.
And you have to do it every year.
And I have to do it every year. But be honest with you.
In Europe, they actually reward people for it.
I wish they would reward me.
But people don't even know about this healthy exam because nobody has enough time.
Well,
it is a very thorough.
And I'll be honest with you, my wellness exam is not as thorough as what you described.
It's supposed to be.
It's not. So, but I think though I come in with a lot of education, so my doctor probably is a little knowing of that.
Any other questions about a metabolic syndrome?
No, I think that's really it. I think that you really helped me understand about this 5 factors, that it's really bigger than just thinking insulin resistance. It's a bigger picture than just these elements, that really if you want to keep your end organ healthy, you need to really consider these 5 factors, and especially if you are at risk for 3 of them, which I'm amazed that I'm at my waist is right at 35.
Well, the other thing too, now that everybody has a smartphone, you have these trackers.
Right.
And you have these things and apps that you can use to help you modify these factors.
Well, I appreciate so much your willingness, and I just can't thank you enough. So thank you to our audience for joining us on this discussion of metabolic health. And please look for us next week, where we're going to talk about some more things that we want to educate in your health. This is MC of Healthy by George. Don't forget to hit that like button, subscribe, and ring the bell to see us every Sunday and Thursday. Bye-bye.
Bye.
So thank you so much for joining me at Healthy by George. I hope you found the information inspiring and that it encourages you on your wellness journey. Because remember, your body, your well-being are a most precious gift, and every tiny action taken daily can make a huge difference. I hope the information here is educational purposes and is not meant to replace your medical care. See your doctor and talk about what works for you. If you enjoyed today's content, don't forget to give it a thumbs up and subscribe to my channel. Your support means the world to me, and it helps me continuing creating content that inspires and empowers you to live your best life. Goodbye for now, and join me again at the next Healthy by George.